Hello, and welcome to another episode of the Dr. Paul Health and Wellness System podcast. I'm Dr. Paul, and I'm so glad you're joining me today. Pregnancy is a beautiful journey, but it can also make ordinary decisions feel confusing. Can you have a massage? Is shortness of breath normal? Are high heels, air conditioners, mobile phones, and skincare products safe? And what can you do if your baby appears to be gaining weight slowly? Today, we're answering these important questions with clear, practical medical guidance, without fear, judgment, or complicated medical language. I'll also help you understand which pregnancy changes are usually normal and which symptoms should never be ignored. So, get comfortable, stay with me until the end, and let's begin with our first question. Yes, you can usually have a massage during a healthy pregnancy. Just choose a therapist who is trained in prenatal massage and always tell them that you are pregnant. Lying on your side is generally the most comfortable position, especially as your belly grows. The massage should be gentle. Never apply strong pressure to your abdomen or massage a leg that is painful, red, warm, or unusually swollen. If you have bleeding, contractions, severe high blood pressure, placental complications, or a high-risk pregnancy, speak with your doctor first. And if anything feels uncomfortable during the massage, please stop immediately. Mild shortness of breath can be normal during pregnancy. Hormonal changes make you breathe more deeply, and as your baby grows, the uterus pushes upward and gives your lungs less room to expand. However, please don't assume every breathing problem is caused by pregnancy. Sudden or severe breathlessness, especially at rest or while lying down, needs urgent attention. Seek help immediately if it comes with chest pain, dizziness, fainting, a racing heartbeat, coughing blood, fever, or pain and swelling in one leg. Your doctor may also check you for anemia, asthma, infection, or a blood clot. Nosebleeds are quite common during pregnancy. Hormonal changes and increased blood volume can make the tiny blood vessels inside your nose more delicate. Dry air can make it worse. If your nose starts bleeding, sit upright, lean slightly forward, and firmly pinch the soft part of your nose for about 10 to 15 minutes without releasing it. Don't tilt your head backwards because you may swallow the blood. A saline nasal spray or humidifier may help prevent dryness. If the bleeding is heavy, happens repeatedly, or does not stop, contact your healthcare provider. Wearing high heels occasionally may not directly harm your baby, but they are not the safest footwear during pregnancy. Pregnancy hormones loosen your ligaments, your center of balance changes, and your feet may become swollen. All of this increases your risk of falling, ankle injuries, and back or pelvic pain. My advice is to choose flat, supportive shoes or a low, wide heel, especially during the later months. If you must wear heels for an event, keep them low, avoid standing for too long, and bring comfortable shoes to change into. Yes, absolutely. Sleeping with a fan or air conditioner will not harm your baby. Your baby is protected and kept at a stable temperature inside your uterus. Set the room to a temperature that feels comfortable. Keep the fan from blowing directly into your face if it dries your nose or throat, and clean the air conditioner filter regularly. This is especially helpful because pregnancy can make you feel warmer than usual. Stay hydrated and use a light blanket if you become cold. For most women, pregnancy is not the right time to deliberately lose weight. Your body needs adequate energy and nutrients to support your baby's development. If you began pregnancy overweight, the goal is usually to control how much weight you gain, not to follow a strict weight loss diet. Focus on balanced portions, nutrient-rich foods, and pregnancy-safe exercise recommended by your doctor. Avoid fasting, crash diets, slimming teas, weight loss supplements, and weight loss injections or medicines unless a specialist has specifically prescribed them. Your doctor can create a safe plan based on your pre-pregnancy weight and your baby's growth. First, please don't panic or blame yourself. This happens to many women. If it was a small amount before you knew you were pregnant, the likelihood of harm is generally considered low. Stop drinking alcohol now because no amount has been proven completely safe during pregnancy. Tell your doctor or midwife honestly how much you drank and when. It allows them to advise you appropriately, not to judge you. Continue your prenatal appointments and recommended scans. If the drinking was frequent or heavy, speak with your healthcare provider promptly. If you feel dependent on alcohol, seek medical support rather than trying to manage it alone. Yes, mobile phones produce low-energy, non-ionizing radio frequency waves, not the ionizing radiation used in X-rays. Current evidence does not show that normal mobile phone use around the belly harms pregnancy or the developing baby. You do not need to panic if you rest your phone near your abdomen occasionally. However, avoid placing a hot or charging phone directly against your skin because of the heat, and never use a damaged device or charger. If you prefer, you can use speaker mode or keep the phone nearby rather than directly on your body, but this is a personal precaution, not a medical requirement. Retinol and other retinoids should generally be avoided during pregnancy. Check labels for ingredients such as retinol, retinol, tretinoin, adapalene, tazarotene, and isotretinoin. If you accidentally used a retinol product once or twice, don't panic. Stop using it and mention it to your doctor. Low-strength salicylic acid used on a small area of skin is generally considered acceptable during pregnancy. However, avoid strong chemical peels, high concentrations, frequent application over large areas, or use on broken skin unless your doctor approves it. When in doubt, show the product or ingredient list to your obstetrician, dermatologist, or pharmacist. Numbness or tingling in the hands during pregnancy is often caused by pregnancy-related carpal tunnel syndrome. Extra fluid in the body can put pressure on a nerve inside the wrist. It may feel worse at night and can affect your thumb, index finger, middle finger, and part of the ring finger. Try keeping your wrist straight, avoiding repetitive movements, elevating your hands, and wearing a wrist splint at night. Speak with your doctor if the numbness is constant, painful, or causing weakness. Sudden one-sided numbness with facial drooping, difficulty speaking, or severe headache is an emergency. Gradual swelling in both feet and ankles is common during pregnancy. Your body retains more fluid, and the growing uterus puts pressure on the veins carrying blood back from your legs. It is often worse later in the day. Rest with your feet elevated. Avoid standing for long periods. Wear comfortable shoes. Take gentle walks. Move your ankles regularly and drink enough water. Please seek urgent medical care if the swelling appears suddenly, affects your face or hands, or comes with a severe headache, blurred vision, vomiting, or pain beneath your ribs. These can be warning signs of preeclampsia. Swelling, warmth, redness, or pain in only one leg may indicate a blood clot and also needs urgent assessment. And that brings us to the end of today's episode. I hope these answers have given you greater clarity, reassurance, and confidence as you move through your pregnancy. Remember, every pregnancy is different, and while many changes are completely normal, you should never ignore a symptom that feels sudden, severe, unusual, or worrying. When in doubt, please speak with your doctor or midwife. There is no such thing as a foolish pregnancy question. If you found this episode helpful, follow, like, and share the video with another expectant mother or supportive partner. You can also leave your pregnancy questions in the comments section. Join us every Monday and Friday for new episodes of the Dr. Paul Health and Wellness System podcast. Until next time, take good care of yourself, listen to your body, and remember, a healthier mother supports a healthier baby.